Setting city clinic. You see the parent of 4-year-old girl who has a suspected urinary tract infection, which she gets frequently. You give the parent a sample bottle and advise on the procedure for collecting urine sample, which the doctor has requested. Now, let's see the task. First one says, find out the reason for the parent's request to see you. Second one says, outline the urine collection process. Get girl to drink water to fill bladder. Collect midstream. Use sterile sample bottle. Third one says, stress the importance of not contaminating the sample. And reliable test results. Cause of bladder infections not identified. Fourth one says, outline the next steps after sample collection. Taken to the clinic within 12 hours. Initial dipstick test. Full lab analysis if needed. Fifth one says, give information about bladder infection in children. Common, caused by reluctance to pee, lack of hydration. Establish what advice the doctor give the parent. Hygiene cotton underwear, unscented, unperfumed product, etc. Sixth one says, reassure the parent about the child not using the toilet at nursery. Example, common face will grow out if she gets used to the teacher. Last one says, give advice on hydration, fruit, ice blocks, etc. Now let's begin the role play. Hi, good morning. I'm Sarah, the registered nurse working in this clinic. May I know the reason for requesting to see me today?
Nurse, the doctor has requested a urine sample for my daughter, and for that, I wanted to see you to get a sample bottle and to check the procedure for getting the urine sample.
Okay, I do understand the concern. Do not worry, I'm here to assist you. Before proceeding further, may I know your daughter's name and age for the record, please?
Sure, her name is Kathy and she is almost 4 years old.
Okay, how may I address you?
You can call me Sarah.
Could you please tell me why the urine sample is being asked for?
Nurse, my daughter is suspected to have urinary bladder infection nowadays. So, for the analysis, the doctor insisted on the urine sample.
Thank you, Sarah, for your confirmation. Now, let me outline the urine collection process. May I proceed?
Sure, nurse. Please.
Thank you very much, Sarah. The first thing you need to do is to encourage Kathy to drink enough water to fill her bladder in order to make her to feel the urge to urinate. As she urinates, collect the midstream urine in this sterile sample bottle. Okay, Ms. Sarah, are you following me?
Yes, nurse. Okay, I will ask her to drink enough water.
Okay, Sarah, it is important to take care not to contaminate the sample in any way because it may give unreliable test results. In such a case, it will be impossible to identify the cause of the bladder infection correctly. Okay, Sarah, I hope it's clear for you.
Alright, nurse, I understand that. And how quickly should I bring the urine sample?
I would appreciate if you could bring the sample as soon as possible so that we can rule out Kathy's condition much earlier.
Sure, nurse, I'll bring it sooner.
Now, let me explain to you the steps after collecting the urine sample. The urine sample will be taken to the clinic within 12 hours. After that, the dipstick test will be carried out. Dipsticks are thin plastic sticks with chemical strips on them that are placed in the urine. Chemical strips change color if certain substances are present or if their levels are higher than normal. In addition, a full lab analysis will also be performed if needed. Okay, Sarah, I hope you're with me.
Okay, nurse, but my daughter keeps getting bladder infections and I don't think this problem will be resolved soon.
I can understand your worry, Sarah. Try not to worry. The bladder infection is quite common among children. It is mainly caused by their reluctance to urinate, or it can also happen due to the lack of hydration. Kathy should therefore be absorbed and encouraged to urinate frequently and to drink enough water to stay hydrated. Apart from that, it is important to ensure that proper hygiene is maintained. And by the way, may I know if the doctor has given any advice regarding the same?
Yes, the doctor gave me lots of advice, for example, about hygiene, which I have been following. He also advised the use of cotton underwear.
Okay, Sarah, make sure to follow the doctor's advice regarding hygiene, wearing cotton underwear and using only unscented products.
Sure, Ness, I'll certainly follow the instructions as advised by the doctor. Besides that, it is really difficult to get my daughter to drink anything, and she doesn't like using the toilet at the nursery. So what should I do?
Okay, Sarah, please don't get upset about the child not using the toilet at nursery because it's a common phase. Adapting to a new environment takes some time. Since she's in a new environment, don't worry, she will definitely grow out of it as she gets used to the teachers. Apart from that, it is also important to make sure that Kathy takes enough water to keep her hydrated. So it is recommended to provide more fruits to Kathy. Fruits have much water content and it can also hydrate her.
Okay, nurse, I understand that.
Also use some ice blocks in her water bottle so that she will get attracted to it and can make her drink sufficient quantities of water. Okay, Sarah, do you have any more questions for me?
No, nurse, thank you for your valuable suggestions. I will get the urine sample as early as possible. Thank you.
Glad to hear that, Sarah. I hope I have clarified all your concerns and questions. You can proceed to get the urine sample now. In between, if you have any more questions or concern, you can ask me. I will be happy to help you. Thank you, Sarah. I wish your daughter a faster recovery.
Thank you, nurse. Thank you very much.
Thank you all. A role play ends here.